Hello everyone. Greetings from HSR Dental Clinic and Implant Center. Namaskar. I am Professor Dr. Deepak Daryani and I am the host for today's episode once again. And today we will be talking about conservative dentistry and endodontics. Now, the term might sound very complicated for you, but conservative dentistry, as name suggests, is about doing the fillings for the dental caries, and endodontics means the root canal treatment. Let's go a little bit more deep into it. So, one of the most common diseases existing, if you see the entire human body, the most common diseases existing in a human being is dental caries, or we call it as cavities. So, what is dental caries? Why it happens? The only reason for the dental caries to form is the lodgement of food particle within the tooth, which a person is not able to remove. Now, when you are not able to remove that food particle, bacteria attacks it and metabolizes it and produces lactic acid as a byproduct. This lactic acid, being an acid, causes decalcification of the enamel, which results in the formation of cavity. Now, you must know that enamel is the outer layer of the tooth and is the dead part of the tooth, and hence it's never painful. So, enamel caries are never painful. So, if you are waiting for the pain to come, you might already be very late. Only signs of enamel caries is darkening of enamel, small black spots, or food getting lodged there but without pain. Now remember one more thing, that enamel contains 99% of calcium and is the hardest structure in your whole body. Whereas the dentine, which is the second layer of the tooth, contains only 55% calcium. Now a normal human being has around 1.5 to 2 millimeter of enamel depending upon person to person or ethnicity. But once this 1.5 to 2 millimeter enamel is breached, the dentine is porous and hence the cavity spreads very fast. Second thing is, the dentine is having only 55% calcium compared to 99% calcium in enamel, and hence it decalcifies even faster. And the third most important thing is, the dentine is porous. It has got a lot of tubules in it, because of which it sends the signal of sensitivity via pulp to the brain. And hence the difference between enamel caries and dentine caries is, the dentinal caries may be sensitive. If the infection has blocked the dentinal tubule, then they may not be sensitive, but in most of the cases, whenever there is food getting lodged or when you are drinking cold or hot water and there is sensitivity, that means there is a dentinal caries. Now, dentinal caries has got one more property. The pain comes, but it is not sustained. It is transient. It goes away. Once you remove the stimuli, it goes away. It's a sign of a healthy nerve inside. And the enamel and the dentinal caries can be treated with the fillings. However, if the infection has gone deep and is nearing the pulp or has entered the pulp or the nerves, then the nerve or the pulp inflammation takes place, which may become irreversible. And for treating this irreversible pulp inflammation, we have to remove the pulp and do the filling inside the root canals, and that is called as root canal treatment. In our clinic, that is HSR Dental Clinic and Implant Center, the Department of Conservative Dentistry and Endodontics is taken care by myself and my colleague, Dr. Garima. Dr. Garima is an endodontist and she specializes in re-root canal treatment. So all the complicated cases with root canal treatment, the fractured files, the failed root canals are usually handled by Dr. Garima, and she takes care of the tough part. The easier part I take care. So today the idea of this podcast is to give a lot of evidence-based, genuine, current information about the cavities, which is the most common disease, so that the listeners can understand it and may get benefited by it in future. here with us Dr. Garima. Dr. Garima, welcome to HSR Dental Clinic. You know us from quite some time now. Please give an intro about yourself. How did you, where do you come from, and where you did your education, what is your experience and all that.
Okay, start. Hi, Dr. Deepak. Thank you so much for inviting me to your this episode. So I come from Delhi. I have shifted to Bangalore 2.5 years ago. I completed my schooling from Doon Public School, and then I did my bachelor's and completed in 2015. I have an overall clinical experience of 10 years. And since past few years, I've been associated with HSR Dental Clinic and Implant Center, and it has been wonderful working together with you. And yes, please let me know how I can give you more insight about root canal treatment and all.
Doctor, prevention is better than cure. How can a person detect that they are having cavity? See, we ask the patient to regularly visit us and we can detect them, but many of them don't do that. So, can you tell us what are the early signs and symptoms of cavity formation when there is no pain, so that they don't come to us late?
Okay. So Dr. Deepak, there are few signals or signs which can help you determine, okay, now this is the time we must visit a dentist. Apart from your journal visits to a dentist, which should be once in 6 months, there can be signs like you see some brownish or blackish discoloration somewhere on your teeth. Others can be you feel food is getting lodged somewhere and you're not able to clean it. Okay? So that can also be a sign there is a cavity in between the teeth. Other things can be you started feeling sensitivity. Sensitivity maybe just by having water, cold water, something sweet, or maybe something hot. So these are the few signs which can help you determine like now is the time I must visit a dentist.
All right, doctor. Doctor, how a patient can find out whether he needs a filling or a root canal? So now everybody is aware that if there is a cavity, it needs to be restored. But in which scenarios a patient may expect to go for a root canal instead of a simple filling?
So there are a few distinguishing features between dental cavity and a root canal treatment. So let's talk about dental caries. In dental caries, you may or may not have a pain. You just see a discoloration. You may have just sensitivity to cold and sweet. But all these symptoms are reversible. That is, you may not need a painkiller. Your pain will not linger on for a longer period of time, and it is still manageable. Whereas in a tooth where it needs a root canal treatment, you start feeling sensitivity to more hot sensations, maybe while drinking tea, coffee. So these are little signs. Other can be severe pain, throbbing pain, a swelling. Later infections, swelling can also come. Otherwise, other things are like while you're lying down. Okay, so lying down also increases pain. That is also a sign that you might need a root canal treatment. Okay, so there is one very stark line that maybe in a root canal treatment you might not feel a pain. Okay, so that does not mean that, oh, I do not need there is no cavity or there is just a cavity. Maybe your tooth is dead. It has already reached a stage, it is dead now and it is not paining you, but still you might need a root canal.
So, doctors, that means there can be a scenario that a root canal may be required even when there is no pain in the dental caries. So, this might be very difficult for a normal person to understand why a root canal is required when there is no pain in the tooth. So, can you put light on that? In which all scenarios a painless tooth may require a root canal?
Okay, so there are some scenarios where a patient might not feel a pain. Okay, so when the cavity started, like you talked about dental cavity just in previous segment. So when the cavity reaches enamel and then dentin, you were maybe feeling slight pain, or maybe when your cavity was in between the tooth structure. So mostly the cavities which are in between. So directly the stimulus is not hitting at the spot where the nerve is exposed. But from in the inside, the bacteria keep on eating away your teeth and keep on eating away your teeth. And from there, it just reaches your nerve and makes it completely dead. So when something is dead, there is no stimulus. But we can take an X-ray, we can see other signs and symptoms we can evaluate like tenderness, percussion. So that is, maybe it is dead but still might need a root canal treatment because the tooth is been eaten away by the bacteria from inside completely. So there is no sensation, no pain.
So doctor, let's take a scenario that patient doesn't require a root canal, he requires a simple filling. So what are the various options which are available for a patient in terms of dental fillings? So please put some light on that.
Okay, so dental filling will depend upon where is the depth of the cavity. So if we are in enamel or in dentine, maybe a normal composite filling, which people mostly call laser filling, will help solve your problem. Like, it's a very strong material, it matches your tooth color, unlike previously amalgam silver filling used to be done in the patients. So now composite is a very good material, a fantastic material, lasts for many years. Okay, serves your aesthetic purpose. So that will be number one choice. Second, if the cavity is deep but still slightly away from nerve, I would say maybe 0.5, 1 mm away from nerve. So we have nowadays so many materials like liners and bases which have very good repair properties because they contain calcium. So they heal the structure from the inside and forms a layer, so that with the filling only we can solve the problem of the mild sensitivity, and over that a composite filling is done. So nowadays the technology is advanced so much that we have so many choices of material, and the dentist is the best to take in proper decision that which is suitable in which case. So Dr. Deepak, let's change the situation, and now let me ask you a question now. So now I want to know about what is dentinal hypersensitivity or dentinal sensitivity, and how can we manage it? Are there any treatments for that? And there are patients who feel ki I do not have a cavity, but still there is some sensitivity. So I would like you to throw some light on it so that people can have more understanding about this topic also.
Well, I think it's a very important question and for the general public, because most of the people suffer from dentinal hypersensitivity. What is dentinal hypersensitivity? It is increased sensitivity to a stimulus like hot, cold, or food getting watched. Now we have to find out why there is dentinal sensitivity or hypersensitivity. Is it due to infection like dentinal caries, or is it due to wear and tear? Now if it's due to the infection, which we can find out with x-rays and all that, we can do a restoration. Or if it's very near to the nerve requiring a root canal, we do the root canal and treat the dentinal hypersensitivity. However, if it is due to attrition, it becomes a little more complicated because you don't have cavities. Now, if there is an abrasion means what? When a patient is brushing too hard and has resulted in hypersensitivity due to removal of the enamel from the cervical aspect of the tooth. What do you mean by cervical aspect of the tooth? The aspect of the tooth which is next to the gum. So he's brushing so hard in to and fro motion that he has removed the enamel and the dentinal tubules are exposed. That's why it's sensitive. Now in such scenarios, we can do desensitization of the tooth if it's a very, very minor enamel removal. We can use desensitizers. There are very good desensitizers like Shield Force from Tokuyama, one of the best in the world, which I use, and we can also use lasers to do desensitization. Shield Force plus lasers can effectively desensitize the tooth. But if the abrasion is more and too much of dentine is lost, then only desensitization may not help because it's a potential area where the food can get lodged, resulting in cavity. So first we will desensitize and then we can do a restoration. However, I feel that the most challenging situation for a dentist is when the hypersensitivity is due to attrition like bruxism. Patient is having a parafunctional habit of bruxism wherein is wearing and tearing away. So the teeth size has reduced, all enamel is gone, multiple teeth have become sensitive. How do you go about treating them? You want to go ahead and do root canals, that can be one of the solutions, but you are doing a lot of damage, right? You are doing a lot of root canal in a lot of teeth and giving crowns. Can we do something more conservative? So my experience here is desensitization with laser only really brings the sensitivity down. We educate the patient, we tell them that this is a situation. If they can manage, it is well and good. Do the desensitization multiple times. If that works well and good, no need of doing any more advanced treatment or irreversible treatment. However, if that doesn't help, then we may have to think about crowns or root canal treatment plus crown. So I think these are the ways in which we can manage dental hypersensitivity. So now let's go back to the original situation.
Sure.
And let me ask you another question about root canal. Doc, patients are terrified about root canals, right? The moment they think root canal, they see such improvements, they are scared. So how do we manage? How do you go about managing such cases? Are the root canal painful at all? Please let's talk about that and let's educate our patients regarding that.
Okay, yes, Dr. Deepak, I understand the moment we tell a patient that you have to go for a root canal treatment, they are absolutely terrified. But what I want to say is you need not be scared of a root canal treatment, because before any root canal treatment, we give you an anesthesia. We make sure that our patient is comfortable. The comfort of our patient is our priority. I would not lie saying a root canal is 100% painless. It is almost painless. So even if the root canal procedure is for maybe say 45 minutes or 1 hour, it won't be like for 1 hour you will be in pain. Maybe for some 5-10 minutes, maybe at some point if there is more infection, you might get certain pain, but it is also just a pinching pain. So pain can be very easily managed by anesthesia and patient will be comfortable. And in the end, I would say ki you need to measure that, that slight pain and compare to something which is not leaving infection in your tooth. So you have to weigh the risk and benefit.
Also, doctor, to add to the points what you said, I think the doctor's compassion also plays a very important role. The doctor has to be having enough time for the patient. He has to feel the pain of the patient because patient is terrified. And what I tell the patient is, take the injection pain, the pain of the injection. After that, it will be pain-free. If you have any pain, raise your hand, we stop working. We don't work till the patient is having no pain. And if an anesthesia is given properly, most of the times, unless there is too much of infection, patient will not feel any pain. And there is another method of giving an intrapulpal injection. Even if there is a swelling pus which is not allowing the anesthesia to work 100%, we can always enter the pulp and give an intrapulpal injection and make the patient pain-free. And then patient doesn't realize. I have had situation where patient sleeps while doing root canal treatment, and that is what I find as the final feedback from the patient. When the patient sleeps when you are doing dental treatment, that means he is absolutely comfortable. So to come to the point, to answer this question to our viewers, it's not that painful.
Yes,
that you are
definitely.
giving him.
Yes.
Yes, injection pain is there, but then after that we can manage most of the pain, and there is not going to be a situation where patient is shouting and we are working. That happens only in the movies. It's
Never.
not happening here.
Never know.
All right, doc, that was a good answer. Let's go to the next question about crowns after root canal treatment. Do you think that crowns are absolutely must after root canal? What is the use of the crown after putting the root canals, and what is your take on putting a crown a must after root canal? What is your take on that?
Okay, so Dr. Deepak, coming about now post RCD treatment, there is crown, or people call it cap also. So the purpose of a crown or a cap is to protect your teeth from any high forces of biting forces, so that the tooth does not undergo any crack or fracture in the future, because in the first place your tooth was already weakened because of a dental cavity. Coming to your next question, is a dental crown is mandatory in 100% all the cases? No, that's not the case, especially in cases where mostly in the anterior teeth, where we see the cavity has not, eaten up the most of the tooth structure, and most of the tooth structure is already there. So we have to see how much tooth structure is there depending upon patient's habit, like we talked about bruxism. Okay, so in patients where there are high eating forces or biting forces, we definitely need a cap or a crown after a root canal treatment for the protection of the teeth. Now, there are different materials for the cap. Dr. Deepak, I would like you to please tell us about different materials and different types of caps which are available for the patients.
Doctor, to add to the point of requirement of a crown, absolutely after root canal, I agree with you. Especially in the anterior, if the cavity was minimum, or the tooth had affected because of some other reason like trauma, we may avoid the crown placement since the forces are minimal in the anterior region, in the front tooth region. But we have another problem of discoloration. Sometimes tooth gets discolored, in which case we can either go for a crown or veneer. Doctor can take a call on that. Coming to the posterior tooth, if it is very conservatively done, there is a school of thought which says that we can prevent crown fabrication and placement of the crown at all. Only a root canal will do. Yes, we can do that, but the tooth is a brittle tooth because it is dead. There is no vascularity, there is no elasticity. We know that enamel can crumble, and if the patient has a parafunction like bruxism, it can split the crown into two. So that's the risk a doctor takes if he says no crown required in the posterior teeth, especially in the molars or premolars.
Yes.
And I highly advocate that check the parafunctional habit like bruxism. Has the patient got a habit of clenching their teeth, because that produces enormous pressure and it can split the crown into two. And if there is a vertical fracture, the game is over. You have to go ahead with extraction of the already treated root canal and then probably with an implant. So, we have to take a call in the posterior teeth. I feel that a crown is almost mandatory. Let's move ahead to the advanced root canal treatment now, which you specialize in. We find sometimes the root canal treatment fails. When do you think that a root canal is required? How successful is a root canal treatment? What is the long-term predictability of a root canal treatment? And what is your take on that? Is it worth doing a root canal, or we should advise a patient for extraction? How do you take that call?
Okay. So Dr. Deepak, talking about now root canal treatment, how will a patient know that he needs a root canal treatment? So if a tooth is already treated with root canal in the first place, but he still feels pain or there is a continued swelling, maybe immediately I would say, or mostly after few months, few years, there is a swelling, there is pus coming from somewhere. Okay, or even if there is no pain, but still maybe you went for a checkup to a dentist and the dentist sees a big infection under your root. So you might need a root canal treatment. Okay, so when can we perform a root canal treatment and when can we not? I would say in almost 80-85% of the cases, we can definitely attempt a root canal treatment. Maybe in cases where there is a fracture, a crack, or the lesion is too big, that is, it has already eaten away your root or bone too much. So we weigh in the risk and benefits. Is the tooth worth saving or not? Will it take the forces in the future for eating? That helps us in deciding that this tooth can go for a root canal treatment or not. So when the tooth is treated for the first time, definitely the success is more than 95%. When we attempt root canal treatment, the success rate, yes, definitely drops down slightly. But now we have so many advanced techniques and all, so we can give a good shot in saving the tooth, definitely. And personally, me being, you can say I am biased because I'm a root canal specialist. I believe something which is natural, you should definitely try to save your natural teeth. So something which is natural will work for a long time. Okay, so my take is that.
All right, Dr. Garima, it was a very enlightening session. I think we talked about a very important topic of fillings and root canal, which is one of the most common dental treatments which are done and for which a lot of confusion exists in the world today. I hope that these insights also helps the people who are listening. And I thank you for joining us, and we plan to have many more such interactive sessions which are beneficial, which can be beneficial for our listeners. Thank you so much. Also, before I sign off, I would like to take this opportunity to inform everyone that we here at HSR Dental Clinic and Implant Center are a team of selected eminent specialists who are working in the direction of giving the best evidence-based dental treatment so that we can have predictable long-term outcomes for the patient. So if you have any queries or any needs related to any dental treatment, you are most welcome to approach us, contact us. The contact details are mentioned here in this episode, and our front desk will help you seamlessly in giving you appointments and for the further treatments. Thank you all so much. Bye-bye.